Hello, in this video we will discuss about the gout disease. This is the disease due to the uric acid excess in our blood. So the 8.3 million people in the US have gout. 6.1 million is male and 2.2 million is female. Gout happens when too much uric acid in the body, forming crystal that the immune system attacks. This causes inflammation in the joint. So the inflammation in the joint like rheumatoid arthritis or osteoarthritis. But this is the different, not arthritis, because it is the deposition of the urate. 90% have kidney that don't remove enough uric acid through urine, not uric. It's my mistake. So through urine, when 10% too much uric acid in their system. Inflammation due to the deposition of urate crystals attack first in single joints and then further progression to the multiple joints. Let's begin to understand the gout causes and risk factor and how to prevent that. Basically, the high purine foods, which that contain purine, the nitrogen double ring containing purine food, which that excessive amount of high purine in the blood, as well as when we will take food, will lead to gout disease, like salmon and other beef and meat, the red meat. Alcohol is also the factor, genetic also. Chronic kidney disease is also as well as diabetes. Diabetic person can more chances to gout disease. So the age factors and male gender also more gout disease as compared to female. Family history, it means genetic, metabolic syndrome like hyperthyroidism or hypothyroidism, and insulin resistance, obesity, dietary factors which that lead to increased risk of the gout disease is alcohol like beer, purine rich food, red meat and seafood. Dietary factors can reduce the risk of gout disease is cherries, vitamin C and dairy products as well as coffee. Medication also can affect the gout disease like diuretics, the drug thiazide for example, and cyclosporine. Let's begin to understand the mechanism of gout disease now, how it can be effect and how can progress. So this is the blood circulatory system and this is the normal tissue cell. So the purine degradation and the purine metabolism will lead to mononucleotide formation, and in this way the urate production via purine degrade will increase and go into the blood circulatory system, that uric acid. But when we will drink more water can excrete that uric acid. Kidney is also involving. So in this way, when increase the uric acid in the blood is known as the hyperuricemia. Under excretion of urine by the kidney and the gut, So under excretion of urate, by the kidney and the gut will lead to also cause the hyperuricemia. When increase the uric acid, the urate into the blood circulatory system will convert into the monosodium urate crystals formation. This monosodium urate crystal formation will target to the macrophage and monocyte. Monocyte will be proliferate into the macrophage. The macrophage contain toll-like receptor 2 and 4, and this signal will also, and on the other hand the node-like receptor P3, which that will form inside the endocytosis, will lead to inflammasome activation, while the toll-like receptor 2 and 4 will lead to nuclear factor kappa B and MAP kinase to release the pro interleukin 1 beta and interleukin 1 beta, which that basically pro interleukin 1 beta convert into the interleukin 1 beta, and it will be moved into the blood circulatory system and form the Gout flare. Interleukin 1 beta is also recruit the neutrophil, and in this way the neutrophil will basically expel DNA and compasses the monosodium urate crystals, and in this way the neutrophils will be damaged. But this clearance will be occur due to the macrophage, but the crystal will be left behind after the apoptosis of the macrophage. When apoptosis of the macrophage will occur and neutrophils will also degrade, and in this way the hydrolytic enzyme will autolysis of the neutrophil and expel DNA and compass the monosodium urate crystal will lead to dysfunction of the neutrophil. Formation of neutrophil extracellular traps with degradation of pro-inflammatory molecules, induction of anti-inflammatory molecules. Example is interleukin 10, transforming growth factor beta, and interleukin 37. This will lead to recruit the site of the joint where the cartilage is here, and the inside of the cartilage the uric acid will be formed in the form of crystal, which that can be lead to cause pain due to the needle-like structure, and assorted cell of innate and adaptive immune responses will occur. In this way, the immune cell will cluster, and the clustering of monosodium urate crystal and chronic inflammation will progress, will lead to cause pain and swelling of the joint. After this, the monosodium urate crystals deposition in tissue followed by chronic inflammation response. In this way, not only the joint can be affected, but the other part of the body can also lead to cause the gout disease. In this way, here you can see the ear, finger, and tissue, which that is involving the gout disease. In this way, what is the gout disease? Gout disease is basically is the inflammation due to the excessive amount of the uric acid in the blood will lead to cause the gout disease. Is the inflammatory disease will cause inflammation and cause pain due to the deposition of the uric acid in the form of crystal due to the and not excess excretion of the uric acid through kidney. So due to the dysfunction of kidney, other things are less water drinking as well as the red meat. So this video was about the gout disease, and I hope you make sense about the concept of the gout disease. If you like this video, please make sure to subscribe, like, and share. And thanks for watching. Bye.